experience, I use PRP injection when I have a tear on the tendon, on the partial tear of the tendon. The rationale is the property that was demonstrated by PRP and by the growth factor that are in PRP to work on angiogenesis, on proliferation, on differentiation of our cells in our tendon, and as well as the role on the collagen production. I have experience about the injection of the PRP in the tendon and the muscle tear, and already there are publications about the experience with the healing of the hamstring injury. Now I use the injection of PRP in epicondylitis or adductor or gluteus medius pathology, or Achilles and patellar tendon tears, as well as hamstring syndrome or fasciitis plantaris. But it's important to underline that the PRP are not the same, and my experience is with high tissue PRP that they use after 1 week after the tear of the tendon, and it's possible after 2 weeks another injection. My protocol after injection is 1 week without unsafe drugs, and an injection that I perform always with ultrasound guide, no had corticosteroid or anesthetic, because of the possibility to reduce the effect of the PRP. And for me, it's sufficient a rest for 24 hours, and sometimes less. It depends from the patient. And the experience is good, but it's important to associate an injection at good protocol of rehabilitation in the standard patients, in non-athlete patients, but also in athlete patients. In the treatment of tendinopathy, it's important to know very well what is the tendon is made. The tendon is important, the collagen fiber, as well as the extracellular matrices. It is important the role of hyaluronic acid. In preclinical study and in clinical study, as well demonstrated that the hyaluronic acid reduces the proliferation of fibroblasts and stabilizes the concentration of type 3 collagen fiber, as well as have capability to reduce the cellular adhesion, the inflammatory response, and improve the cellular viability and the tenoblast number, and also a role on angiogenesis. It is important the use of yellow tend in our tendinopathy that is always more frequent, and it's important to inject with yellow tend the zone around the tendon to improve the healing of our tendon. Professor Frizziero and other studies are well demonstrated how the hyaluronic acid bend on the cells on the receptor CD44 and induce on the sinusitis on the matrix all the feature that I already talking before. And in the clinical study on patellar tendon and on Achilles tendon, all the score was improved. It is important also associated for the correct healing on the tendon, also a correct rehabilitation program. And the number of injections could be 1, 2 or 3 according to the situation of the tendon that we have to check with ultrasound and also check for our patients with the functional score. The combined injection of hyaluronic acid plus PRP in treatment of tendinopathy is not useful because the action of hyaluronic acid and PRP in some cases are the same, and it is possible that we have to use a lot of product that for space motivation is not possible to put inside the tendon. And it's possible start the treatment with PRP if you have any lesion, any partial tear, and after treat with hyaluronic acid on the follow-up of the patients. In case of tendinopathy with the association of ossification with gap that is less than 3 mm, for me the indication is treat the lesion with hyaluronic acid, because you can restore all the biologic of the tendon. But if the lesion are more than 3 mm, it's possible the use of PRP to fill the lesion with growth factor and improve the healing of the tendon, and it is possible after continuous the treatment with hyaluronic acid. Dentitis is a very complex structure that is important when we have a problem with our patients and we have to treat dentitis. My choice is PRP because I can treat the bursa, the insertion of the tendon, and also all the structure that is around the tendon. In my opinion, all the injection in or around the tendon have to be performed by ultrasound guided, because it's not possible perform the injection in the specific part of the tendon that we want without an external guide, and it's possible create a pain of the patients and lesion in the tendon if our product go inside a healthy tendon.